Good afternoon. I'm Kimberly Wickert, and I would like to welcome you to our Retain Employment Seminar Series this afternoon. Today, we will be focusing on return to work, a sustainable approach to empower patients and employees in self-advocacy strategies in healthcare and employment. We will be sharing this PowerPoint presentation after our webinar via email, and it will be on our Retain Kentucky media channel. If you have questions during our presentation, please put those in the Q&A box and we will answer those for you as well. We have a lot of information to share with you this afternoon in our time together with the goal of learning proactive strategies to collaborate with healthcare providers in the stay at work and return to work process. We will also share the benefits of the stay at work and return to work process from all stakeholder perspectives. And finally, we'll show you how to access Retain expertise in your stay at work and return to work efforts. Joining me today is Dr. Matthew Adamkin, Assistant Professor at the University of Louisville School of Medicine, Department of Neurological Surgery in the Division of Physical Medicine and Rehabilitation. Welcome, Dr. Adamkin. Let's get started. So this slide reveals traditional ways that information will be shared by the patient, of course, sometimes their family member, employer, case manager, and other rehabilitation team members. Dr. Adamkin, can you share other ways that stay at work and return to work information is typically communicated to you, and what works best in order for you to make recommendations for positive outcomes?
Yeah, and thank you for the introduction, and thank you for having me here. So I think traditionally the old process of discussing return to work with a patient has been a very passive one, and it requires either the physician initiating the discussion or maybe a more proactive patient really defining that as one of their goals is to return to work. And I think moving forward, this really needs to be a more proactive process on both parts, by both the patient and the employer. It needs to be a goal of the treatment strategy from the beginning. And with this program, it can really be all members working as a team with the physician, the patient, return to work coordinators, all to find solutions in order to achieve the common goal, which is getting back to work. The way we like to frame it, particularly as a rehab physician, we like to focus on what we can do as opposed to what we cannot do. And we'll talk about it more, but really reframing the conversation away from restrictions and towards accommodations, I think is the best way to start this process and really begin the communication to look for a positive outcome.
I love that. And as a rehab counselor, I really like how you laid the groundwork for staying away from that restriction term and identifying what someone's capable of doing. So thank you for sharing that. So this slide outlines other rehabilitation team members who you may rely on for objective information about your patient. Dr. Adamkin, how can an occupational therapist, a physical therapist, or a speech language pathologist help you expedite your patient's functional abilities and ultimately their return to work?
Yeah, I think the most foundational thing here is just understanding what these three types of healthcare professionals really do. I think it's unfortunate, but a lot of physicians never really get trained or understand the differences between an OT and a PT, say. So if you don't really know what they do, we're not going to best be able to utilize their services and work with them as a team. So very broadly, when you think about a physical therapist, you're thinking about mobility, you're thinking about transfers. When you're talking about an occupational therapist, you're thinking about self-care and activities of daily living. And when you're thinking about a speech pathologist, you're thinking in terms of three different categories, one being communication, one being cognition, and another being swallow. Now, if you are just referring a patient to physical therapy without any specific direction, then they'll work on mobility. But if you're able to give them very specific job tasks and expectations to work on, then you're going to much more successfully achieve the goals that you need in order to get somebody back to work. In other words, if I know that somebody is going to have to climb 3 flights of stairs at their job several times a day, then that's a specific goal that they can work on with a physical therapist. If they have a repetitive motion that they need to be able to do that's fine motor, I can put that as a goal when I'm referring somebody to an occupational therapist or discussing a case with one of these therapists so that we can all be on the same page about what we really need to accomplish. So if we are viewing things through specific job tasks, we get a lot further. But the only way to do that is to really understand what these healthcare professionals bring to the table in the first place.
Absolutely. That's great. Thank you for that information. In addition to the patient, we've talked about the family member and other rehab professionals involved in sharing information with you as a healthcare provider. Are telemedicine, such as a remote or virtual visit with employers and the patient, options that you've experienced to help a patient stay at work and return to work? And if a patient wants an employer involved in their recovery and return to work planning, what are your recommendations for how they can best participate?
Yeah, this is such a great one because it really gets back to that proactive mindset that I was talking about a couple slides ago. I think from an employer's involvement, the most helpful thing that they can do, and it goes back to our last discussion point, is really provide the specific job tasks. Right now, a lot of what we'll get from employers is standard paperwork that will just be essentially a blank paper that's asking for um, what restrictions are needed and what's the duration until recovery. And unfortunately, I lost my crystal ball, or maybe I missed that day in medical school, but it's hard to say that on September 1st, somebody's going to be back to their prior level of function, if it's 3 months away or 6 months away. And unfortunately, I don't think physicians are great at estimating these things. And we tend to probably overestimate and keep people out longer rather than rush people back. But if we change that framework through discussions with the employer and really understand what do we need to accomplish, how can we accommodate somebody as opposed to restrict them, I think we can get much further. And I think from the physician side, it's a two-way street. The physician really needs to provide easier access to an employer in order to communicate that information. You mentioned telehealth, and I think that's one of the maybe the only good thing that's coming out of this pandemic is the much more common utilization of different telehealth strategies. And I think that's a big opportunity. Um, Historically, the patient slash employee is very caught in the middle. It's almost like a game of telephone where they're talking to their physician, they go back to their employer, they get information from their employer, they take it back to the physician, and it's very inefficient. It has to wait from visit to visit. And I think a lot can get lost in translation doing that. Telehealth is an opportunity to bring multiple people together and provide that access. And I think that is really the onus is on the healthcare provider, maybe even more so than on the patients. But as long as everybody's got their vested interest in it, then I think we can really accomplish things.
That's great to hear. And I know platforms such as what we're on today in Zoom have HIPAA compliance so that, as a healthcare provider and employers and patients also can know that that information can be shared in a confidential and private manner as well. So that's really good information. Thank you for sharing that and for that invitation to be able to openly have that proactive communication with you and other healthcare providers. So we'll take it a step further and talk about ways to proactively communicate with healthcare providers. Can be sharing your company's stay at work and return to work culture, which is included in this slide. And that can be also via a company tour in person, or again, virtually. Maybe another good, thing that came out of the pandemic. By sharing your company culture. So you as the employee patient, or you as the employer, can also share your company culture, including your mission, vision, and values from what is shown on your website. And also by providing and educating healthcare providers on alternate or transitional duty options for stay at work and return to work. Additionally, any specifics to an employee's ability to work based on seniority, seasonal work, certifications, or other requirements could be helpful in the healthcare provider's knowledge of options for the patient. Dr. Adamkin, can you share your experience on how to best communicate employer and return to work information with you as the healthcare provider? And I think you probably touched on a lot of it in the last slide, but anything in your experience that anyone has done specific to some of the proactive communications that you can think of?
Yeah, I think there's a couple things here. One, this is where those return to work coordinators can be immensely valuable in allowing kind of a point of contact between physicians and patients slash employees. I think the other thing here, and you're right, we talked a little bit about it with telehealth, but even beyond that, the emerging technology in healthcare with electronic medical record systems, they really provide a direct point of access and easy direct communication to and from physicians. So rather than having to go through call centers and leaving messages with medical assistants who might communicate to somebody else, and there just being a delay in communication, a lot of our electronic medical records now allow patients to directly contact their physicians, and essentially it's like a text message slash email setup. And these documents or other information could be easily sent directly to the physician, and it just allows for much more efficient care and communication.
That's a great point. And I think people who might be a little intimidated about verbally sharing information with their healthcare providers, either in person or over the phone, can possibly feel more comfortable doing it in that format. So thank you for bringing that up. That is a great takeaway for all of us on the webinar today. So I'm going to take this a step further from your points a few slides ago about functional job descriptions, because they're a great tool to share with a healthcare provider in a timely manner when you're treating an employee or your patient. And it's also important to ensure that they're accurate and current. And example of that is if something has changed based on an industry standard, maybe a machinery upgrade or shift changes due to having to social distance during a pandemic, it's important to ensure that this is accurately reflected in the job description at the time of the change so that you can make informed decisions as the healthcare provider. The physical demands of the job, outlining the essential functions that you pointed out earlier, Dr. Adamkin, as well as environmental conditions, is crucial to the stay at work and return to work process. And I know that you recently shared a case study with me about being asked if a patient could return to work, and you really didn't have the functional job description to be able to have objective, factual data specific to those essential functions. Can you share with the webinar audience that scenario or a similar scenario and the information you would have found helpful in determining if the patient was able to return to work at that time?
Yeah, absolutely. And unfortunately, this anecdote is one of many. I had a young man that I was working with who had an injury, and he worked as a security guard. And we had sent him for a functional capacity evaluation, but we did not have a functional job description. So The functional capacity evaluation is a very objective measure, very detailed assessment that tells you what someone can do. And I get this very long printout, and it tells me how fast they can walk. It tells me how long they can stand. It tells me how many times they can lift 50 to 75 pounds over their head, all these details, range of motion of their back, all sorts of things. And it's very interesting information, but it does not necessarily align with job requirements, right? So I didn't have any idea if this young man ever had to lift something 50 to 75 pounds over his head, or maybe he had to lift something 100 pounds over his head. So while I had a lot of objective information, it didn't necessarily help us get closer to getting him back to work because we didn't have a good understanding of what exactly was required of him. So these functional job descriptions can really be immensely helpful and can bridge that gap.
Great, thank you for that. So I'm going to pause here for just a moment. It doesn't look like there are any questions in the Q&A box, but let me just confirm that. Okay. So I am going to move on and look at the next slide that illustrates stakeholders that are involved in the stay at work and return to work process, including, of course, the employee/patient, again, family members, the employer, the healthcare provider, and the retained return to work coordinator, as well as the other members of the rehab team. Dr. Adamkin, are there other stakeholders that you've worked with in the stay at work and return to work process that we should be aware of? And what is the impact on the patient?
Yeah, I think, and just looking at this slide, I mean, this is a lot of people that all really have their interests aligned. Everybody on this slide is trying to achieve the same outcome, which is getting somebody back to work. And it's good for each of these individual stakeholders in their own unique way. I think one other stakeholder that could probably be added here is somebody's coworkers. If you think about coworkers who might be covering shifts while somebody is out of work, or perhaps working in a role that they are not accustomed to, or having to cover two different responsibilities, I think everybody has a vested interest in getting an employee back to work, regardless of what lens they're really viewing it through. And I think when you think about that, if you get enough stakeholders to the table, you should be able to achieve this outcome.
Yeah, absolutely. And that's a great point. And I think, not only are those coworkers interested in getting the employee, patient, coworker back to work, but oftentimes you mentioned earlier about accommodations, those accommodations that are sometimes made to bring that person back to work or keep them at work can also increase productivity and safety for other workers, not just singularly that employee/patient. So that's a really good point. Thank you for sharing that as well. So we're going to move on and talk about benefits. And as the patient and slash employee returns to functional abilities, including work, maybe they're also, pursuing an education outside of work, home activities, you can imagine their social interaction also increases. And all of these activities promote sustainability in their functioning, which is something that we promote within the Retain grant. Dr. Adamkin, how can we increase the benefits of a patient's sustainability in the return to work process? So once they're no longer in the acute phase of treatment and they need to be able to advocate for themselves and prepare for changes in their roles as their functional abilities change, they can do so.
Yeah, and I think this is so important and really something that a healthcare provider needs to be discussing with somebody as they go through this process, because adaptability is really paramount. You have to manage expectations when somebody's going back to work, because while returning to work is a huge accomplishment, it's not the end. That first day back at work is not the end. It's an important step in the process, but what day one on the job looks like may look very different than what day 100 looks like. And both those days may look very different than prior to when the person got injured or ill. I think we have to think about recovery as a process, whether it's days, weeks, months, or even years for somebody. Somebody might be dealing with new lifelong impairments that they'll never fully recover from, but can be accommodated. Um, the key, I think, is to stay positive, focus on achievement and what you can do and what you have successfully done, and build on that, as opposed to getting bogged down in what you feel like you cannot do. Because, like I said, this is all a process, and being adaptable is really how you allow to sustain your recovery and your return to work.
Absolutely. That's a great approach. So with the challenges employers throughout Kentucky are experiencing now with recruitment and retention, obviously retaining a valued employee is a monumental benefit to employers. We also see benefits to the employer in the promotion of the stay at work and return to work culture, which can be pervasive throughout an organization and lead to an inclusive workforce. Lastly, by promoting that stay at work and return to work culture, it can enhance the community outreach of the employer through partnerships to identify temporary transitional work alternatives with local charitable organizations. As a healthcare provider, your patient outcomes are your top priority, but their success also contributes to their family's wellness and the employer's outcomes, as well as the community overall. Dr. Adamkin, can you give examples of how you've seen this in action, and other benefits are there to you and other healthcare providers in the stay at work, return to work process of your patients?
This is a great question. I think when people first start to discuss and plan for returning to work, what's at the forefront of their mind is income and insurance, tangible things. I think what a lot of people don't realize is that employment outcomes and health outcomes are tied. They're very, very related. Um, Not only is there the tangible benefit of getting back to work, but there's also a social benefit, like you discussed. There's a physical benefit to getting out of the house and going to the workplace. And there's an immense psychological benefit. There's a feeling of self-worth when somebody's able to provide for oneself or for their family. I think the mental health component to this is immense and might even be more important than the physical component. I think the pandemic has really pulled back the curtain on the link between mental health and employment for a lot of people. And when you're having discussions with people about going back to work, they might not always think of it through that lens, but that is the way that they will really feel the benefit of getting out of the house, getting back to work, beyond just having their income back.
Absolutely. Thank you. And one way that we can help them do that is through participation in the Retain Kentucky grant, which is a multi-systems community change approach to retain job talent within Kentucky. And it's led by the Kentucky Department of Workforce Investment, the University of Kentucky Human Development Institute, as well as the Council of State Governments, all of whom implement a stay at work and return to work strategy across health, employment, and public health to support those individuals as they experience illness or injury that impacts their ability to work. And the Retain Kentucky grant provides immediate support and assistance to maximize the likelihood of that employee staying at or returning to work. Working with others is what our Retain return to work coordinators do to promote the stay at work and return to work process. The team can vary based on the needs of the employee participant, but as you can see on the slide, we work with the healthcare providers and rehab team, as well as the employer, to help the employee. And I can attest to the fact that our Retain Kentucky Return to Work coordinators are good at so many things, but the scope of their services include case management, assisting with the accommodation assessment process, the job seeking skills training, and also job placement and development services. They can collaborate with Kentucky Office of Vocational Rehabilitation when needed to support the employee, and also connect participants with resources for social determinants like transportation, childcare, food, and housing resources when needed. Dr. Adamkin, can you share how you've collaborated with our Retain Return to Work coordinators in the Stay at Work Return to Work process?
Yeah, absolutely. I think when we talk about the stakeholders here, we're really talking about a large team. Again, people all with the same vested interest, and I view the return to work coordinators as an invaluable point of contact. They're very, very accessible, and they really can help somebody navigate a very complex system. You look at all these things and all the skill set that a return to work coordinator has. The average person who was working and now is no longer working probably looks at this slide and doesn't understand a thing on it. And that is perfectly okay, because the return to work coordinator is there to guide them through this process and fall back on their experience. And again, with all the people with the same goal in mind, having that return to work coordinator kind of be the pilot or the captain of the ship steering people towards that goal is so incredibly helpful. And really, I think the biggest selling point to this entire program. So just having somebody that knows what the barriers are to get back that we might not even be thinking about, and not only identifying the barriers, but knowing how to get past them. So important.
Absolutely. And when a participant has a goal to stay at work at their present employer, the Retain Return to Work coordinators can support this process through the work experience survey, the functional job analysis that we've already talked about earlier, coordinating assistive technology assessments, and then using that information in the interactive process when asked to do so. We also collaborate with the Job Accommodation Network, or JAN, to help identify and implement accommodations in collaboration with the participant and the employer. And I mentioned the work experience survey, and here's an example that allows us to begin communication and assist in the interactive process by the employee identifying ways they can stay at work following an illness or injury. Career exploration, job seeking skills training, job placement and development, and job retention are a few other examples of tools that our return to work coordinators can use to promote the return to work process for employees. And participant criteria for Retain Kentucky includes someone having an injury or illness that is not work related, being currently employed or having been employed within the last 12 months. In phase 1, which we're currently in through September, they need to work, live, receive healthcare in 14 counties that surround Louisville and Lexington. In phase 2, the criteria will be that they need to be a resident of Kentucky, and that starts October 1st. And then lastly, that they have not applied for or they're not receiving federal disability benefits, including Social Security disability insurance, as well as supplemental security income. So we want to make it really easy for someone to refer themselves, or for you as an employer or a healthcare provider to make a referral to Retain. You can do so by calling us at 859-562-3251, email retain@uky.edu, or visit our website at kyretain.org. I don't see any other questions, but but we are going to be uploading this to our Retain Kentucky media link. And we will also be sending out this PowerPoint to those of you who have registered for today. And so you'll get this link in the PowerPoint. Our employment seminar series from May is already uploaded on there, and future information will be loaded on there as well. So I would like to thank Dr. Adamkin for your great information and takeaways. I know I myself learned several today. So thank you so much for joining us, as well as everyone who has joined us from our webinar audience this afternoon.
Thank you for having me.
You're welcome. Have a great day, everyone.